Welcome. I'm Dr. Craig, and today we're going to talk about the Master Reset. In this introductory video, we're going to be discussing how the body operates and how it's controlled, and then how it begins to fall apart, and then what we can do to reestablish central nervous system control over the body and the neuroendocrine system so that you can be allowed to fully heal. In order to understand how the body falls apart, we have to see first how it works. So, this structure right here is the brainstem, and this is a collection of every single nerve in the entire body. In order for the body to be controlled, the central nervous system has to use nerves. Nerves that travel all over the body. They're detecting information about our environment or what's happening inside the body on the cellular and tissue level. Things from our environment, we're maybe detecting pain, temperature, pressure, movement. Things on the inside of the body, maybe we have an injury or a disease process or an infection or some sort of degeneration. And this information has to be carried on nerves. Nerves will then go to the midline, to the spine, where they enter in on both sides of the vertebral column on spinal nerves. Then the spinal nerves then go directly into the spinal cord, and the spinal cord travels up, and it has to go through the neck. This is the back of the skull. This is C1, C2, and C3, the top three cervical vertebrae in the neck. They're going to have to travel through the neck, through that hole. This hole is called the foramen magnum. That's Latin for giant hole. And then the brain receives the information and it sends a motor response back. The motor response back can be to do something like move away from something, react. Maybe the information sent back is to initiate a healing response or some sort of hormone production or some sort of neurotransmitter or an inflammatory response. Either way, there is information going in, the brain makes sense of it, and then there's information coming back out. It is a level of constant communication happening at every second of every single day. And so, this has a collection of every single nerve in the entire body before it enters into the brain. These yellow nerves are separate. These actually are not going through this structure. They are starting in this structure. They are originating in this structure. And these are the cranial nerves. And so the cranial nerves are responsible for the vital functions of the body. And so we have 12 of them. And as an example of their functions, we're going to talk about how they control sense of smell and vision, pupillary constriction and eye movement, jaw function and sensory information to the entire head, face, teeth, gums, and jaw. We can also move the face and run the glands of the face. So your tear ducts, your nasal mucosal, and your salivary glands. Facial nerve also does part of your taste buds. We can balance through the vestibular system as well as here, that's in your inner ear. And then the glossopharyngeal nerve helps to drain the inner ear through the eustachian tube. It can detect sensory information and fluid and pressure inside the inner ear and allow those to drain. We can also regulate the gag reflex and the swallowing sequence and control the epiglottis, which covers the trachea and the esophagus to prevent air or fluid from going down the wrong pipe. It also has sensory receptors on the carotid artery that detect changes in blood pressure and water volume, or blood volume. And so we can regulate blood pressure that way. The vagus nerve does what we call parasympathetic input. This is your rest and digest autonomic function to every major organ below the neck. And then accessory nerve innervates your upper trapezius and your sternocleidomastoid muscles. And these are responsible for holding your head on the horizon so that you can have balance. And the hypoglossal nerve moves the tongue, which of course you need to chew, swallow food, speak, and breathe. And so all of these structures and all these nerves existing right here then makes the brainstem the most important area in the entire body, which is why it's located very close to the brain itself and up high in the central nervous system. Just in case we were to have an injury to the spinal cord, we don't want to lose vital functions, which is why these cranial nerves further exist and originate, not travel through, but originate in the brainstem itself. The central nervous system is so important to the human body that we don't even want there to be blood near it, okay? We don't want anything that happens to get into the body, whether that's an infectious process or a toxin or some sort of heavy metal or halogen, to get into the central nervous system where it could potentially do damage. So we're going to surround the entire thing through what is called your blood-brain barrier. Blood-brain barrier is also known as your meninges. You may have heard of meningitis before. That's just inflammation of the meninges. And the meninges serve to protect the central nervous system from everything else inside the body. Since there's not even blood allowed, we're going to have its very own circulatory system. The circulatory system is seen here in blue. Notice that there are arrows that indicate the direction of flow, and it contains all of the things necessary to run and operate, as well as heal and regenerate everything inside the central nervous system. So number one, there is neurotransmitters. Neurotransmitters are how the central nervous system communicates with itself. So if you want to think or have memory, learn emotions, behaviors, actions, movement, or you want to turn on or off the brain, you're going to use neurotransmitters, stuff like dopamine and serotonin, as well as GABA and glutamate. They are transported through cerebrospinal fluid. Sometimes we need to have long-term control over the body. Nerves are great for doing short-term and very fast control, but we need maybe longer than just a millisecond. And so we're going to have hormone production. Various organs in the body make their hormones. You have your own sex organs, you have your adrenal gland and your thyroid. These are some that people are familiar with, and they produce hormones that help us to control long-term functions of the body. They don't act arbitrarily though. And so there is a structure that controls them. There is a regulatory structure, and that is known as your pituitary. And you can see that here on the screen. And the pituitary connects via the hypothalamus to the brainstem. It's receiving information through the brainstem about the levels of hormones in the blood. And whenever there is a discrepancy, too little or too much, we're going to see the pituitary then make more or less of its own hormones. They're called neuroendocrine hormones, that then tell the other organs to make more or less of theirs. And so there's this negative feedback loop that is a tightly regulated system in how we control hormone production. The pineal gland, seen right here, is also going to help us regulate our sleep cycle. Whenever light stops coming into the eye, the pineal gland is going to produce melatonin, which is transported through cerebrospinal fluid, and this allows us to go to sleep. When the light comes back on, the pineal gland stops producing melatonin and we wake up. So this is how your sleep cycle is regulated, and it also operates based on a 24-hour clock. Inside the cerebrospinal fluid, we have a system also known as the glymphatic system. Recently discovered in 2012, it is essentially the lymphatic system of the central nervous system. It acts as a filter to remove any infectious process, toxicity, heavy metal, halogen, or metabolic waste that happens to be trapped inside. And we don't want these structures doing damage, so we have to have a way to filter them out. It is run by specialized cells in the central nervous system. They're called astrocytes and microglial cells, and they help to remove these things so that we can keep this central nervous system very clean. And then further, we have nootropics. Nootropics are nerve growth nutrients, and they are so that we can rebuild structural components and any new nerves, say that we're gaining memory or we're learning something through neuroplasticity. We can heal, regenerate, and grow new central nervous system tissue. So how important is cerebrospinal fluid? It's essential. You need it. It's as important to your livelihood as blood is to the rest of the body. If you bleed out, you die. If you run out of cerebrospinal fluid, you die. This is the pituitary. The pituitary, if you remember, we just talked about this. It's connected to the hypothalamus and then further to the brainstem, where it's receiving information about the levels of blood hormones in the body. It's going to then release its own hormones, neuroendocrine hormones, that will then tell the other organs to make more or less of theirs. So this is the system in which we control hormone production. This is not an all-inclusive list, but we're going to go over some of the more important ones. And so you can see how the vitality and the physiological function of the body is maintained. As an example, we can do things like control water retention and blood pressure and blood volume. We can maintain a menstrual cycle and induce labor. We can also develop breast tissue, have breast milk production, and breastfeeding. We can also control internal temperature regulation in part, as well as regulate the energy and the metabolism. That's the turnover of the cells and how fast they're turning over. The adrenal cortex is going to produce a variety of hormones, namely to one, produce adrenaline, right? So this is otherwise known as epinephrine and norepinephrine. We can also produce cortisol, which is your long-term stress hormone. Aldosterone is also another hormone secreted through the adrenal cortex, and it helps to regulate our electrolytes, sodium, potassium, and chloride. And these things are how we run our nervous system, our heart, and contract our muscles through what's called the sodium-potassium pump. We can help also generate in part vitamin D, and then further we can run the melanocyte production, which then allows us to absorb UV radiation. There is part of the adrenal cortex that stimulates the production of the immune function as well. Growth hormone is whatever we need to use to rebuild ourselves. And so kids have a lot of this because they're growing, or if we have an injury or a disease process or degeneration and we need to grow new cells back, we're going to need growth hormone. And our sex hormones, testosterone, estrogen, androgens, and progesterones are all secreted by our sex organs. But again, all of these organs are not producing their hormones arbitrarily. They're being told to by the pituitary. And the last thing that we need to understand is what would be called autonomic function. Autonomic is just another word for involuntary or automatic. And so we have two parts of this system. We have what is called parasympathetic, and then we have sympathetic. For the sake of this argument and the sake of this discussion, we're going to discuss that parasympathetic is really your rest and digest function. You're also sleeping, you're eating, and you're going to the bathroom to remove waste. If you're not in parasympathetic, then you are in sympathetic. So we are going to refer to this one as your fight or flight. This is also exercise, movement, walking, running, etc. Any part where you're using your musculature. In parasympathetic, the blood is at the midline because we are running digestive function. And then when we are in sympathetic, the blood is at the extremities because we need to use our muscles. Over here in parasympathetic, we're going to rebuild ourselves, regenerate, and we're going to be able to go to sleep and repair. Over here, we're going to be breaking down. As we use our bodies physically, they're going to be able to have small micro tears or catabolic breakdown processes that we then have to rebuild. So we're going to talk in detail about what parasympathetic looks like. If we are resting and digesting, sleeping, eating, or going to the bathroom, we don't need to see the world, so we're going to start by first constricting our pupils. This allows less light to come in, which then in turn allows melatonin production to potentially start and allow us to go to sleep. If we are resting and digesting, that's part of how we eat and digest food, so we're going to turn on every single digestive function and all of their organs. And so salivary glands produce saliva. This is how we break down foods in the mouth. And then we're going to lubricate those and swallow. And as we swallow, peristalsis is a process in which smooth muscle contraction pushes food through our entire gastrointestinal tract. And so once the food reaches the stomach, it awaits hydrochloric acid, which the stomach produces through parietal cells in order to break down foods chemically, and also serve as a barrier of protection so that we don't take in infectious processes that would otherwise do us harm. Protein is mostly digested in the stomach. The stomach contracts, and once the foods are broken down mechanically and chemically, we're going to dump that acidic content directly into the small intestines. Now, the stomach is designed to have acid in it. It has specialized cells to act as a barrier of protection. But the small intestine is not, and so we need to actually neutralize that acid. The gallbladder is going to release bile, and the pancreas is going to release bicarbonate right at the very beginning of the small intestine so that we can take that pH of 1 acid and we're going to turn it into around a pH of 6. It's going to neutralize this, and so that we don't have acid running through our small intestine, destroying our absorption capacities. And then bile also helps to break down fats chemically. And then we have the pancreas with digestive enzymes releasing amylase and lipase, as well as other digestive enzymes to break all of the foods that we eat into small pieces. The gallbladder doesn't make bile, it just stores and concentrates it. The liver is the one that makes it. As the foods are broken down into very small pieces, we can finally absorb them. And so we're going to actively absorb them across the small intestinal membrane, and we're going to take them to the first spot, and that is the liver. The liver serves as the processing, manufacturing, and production site for everything that comes into the body as far as nutrients and anything that enters in that's not nutrients. So First, it's going to process, we don't want poisons, toxicities, infectious processes that have made it past our first line of defense. We're going to be able to neutralize those and then filter them out. And then we're going to start storing nutrients for production purposes later. If you've got a hole in the road, you're going to fill it with asphalt. If there's a hole in the drywall, you fill it with drywall. If you have a hole in the earth, you're going to fill it with dirt. And so if you have a hole somewhere in the body, otherwise disease or damage or degeneration, you're going to need to fill it with the stuff that it's made from. And the liver is going to be the one to make it into the specific shape needed to put it into place. So we take in the foods that we are designed to take in, and our liver is going to produce the actual part necessary to rebuild us. Once the liver has produced what we need, it's going to attach it to a transport protein. Think of that like a train. It's going to be sent through the blood, and we need it to be put on a carrier molecules because sometimes we're sending out something that is fat soluble, like cholesterol. And cholesterol and fats and oils don't mix with water, blood, and so we need to have something that transports them through. And they're going to go directly to where, number one, the central nervous system told it to go, and then two, where there is inflammation. And so think of it like you're a ship, okay? And you're sinking in the middle of the ocean, it's night outside, and the first thing you're gonna do is you're gonna scream Mayday, right? You're gonna get on your radio, you're gonna say Mayday, hey, we're going down. And the nearby ships who may have listened to this radio frequency, they have now your coordinates, and they're gonna turn and they're gonna go to wherever it is that they need to go to help you. But it's a really big ocean, it's dark outside, so they don't know exactly where you are, they just know the general vicinity. Well, if you want to get their further attention on a precise location, then you're going to shoot off a flare. And the flare allows people to identify exactly where you are. Inflammation is a chemical flare. Inflammation is the chemical signal that draws in the red blood cells, which is oxygen, the white blood cells, which is the immune cells, and then we have also all the transport proteins bringing in the exact pieces needed to repair whatever damage is done to the cells and tissues. It's dark inside your body, okay? There's trillions of cells. In order to know exactly where to go, inflammation must be present. And we've all been taught that inflammation is what? Good thing or bad thing? If you're listening to this video, you're probably thinking in your head, oh yeah, it's a bad thing. It's not, okay? And inflammation is what they call absolutely necessary. It's essential to your healing process. Without inflammation, you do not do any healing. Once we've absorbed all the nutrients through the small intestine, all we have left is water and waste. We're not going to be wasteful with the water. We're going to absorb that across the colon wall. That's the large intestine, and then we're going to send the waste out the other end. Fat-soluble waste goes through the colon, and water-soluble waste goes through the kidneys and the bladder and the urinary tract system. If you're eating, sleeping, resting, and digesting or going to the bathroom, you do not need an elevated heart rate, breathing rate, and blood pressure, so all three of those are going to go down. This is what we call rest and digest parasympathetic function. If you're not doing rest and digest, you are doing fight or flight, which is sympathetic, okay? You cannot be in both of these systems at the same time. You cannot be in neither, and so you must be in one or the other. So if you're not in parasympathetic, where are you? You're over here in sympathetic. And we're going to be doing the literal opposite of everything that was happening in parasympathetic. So if we are maybe exercising or moving, or we're walking around the earth, or we're running away from somebody, or we're fighting somebody, you need to see what's going on. And so we're going to dilate our pupils. We're not worried about digestion. Digestion is done over here. And so we're going to turn all of the digestive organs down, if not all the way off. And so we're going to shut off saliva production. We're no longer running through peristalsis, which is the pushing of food through the GI tract. We're not worried about hydrochloric acid production and digestion. Gallbladder, pancreas are inhibited. The liver is no longer storing nutrients and building. We're not sending waste out the other direction because it would be silly if you're running from a lion to have to stop and take a bathroom break. We're going to turn all the digestive processes into the background. We need the blood to be where the muscles are. We're going to be using ourselves physically, so the blood doesn't need to be at the midline. Where does the blood need to be? It needs to be out by the extremities where the muscles are. And in order to get it there, we're going to use our adrenal glands to produce adrenaline. In the times of stress and in direct relationship to how much stress we have, we're going to produce a certain amount of adrenaline. And how much we have is going to dictate how high our heart rate, breathing rate, and blood pressure go. When the blood pressure goes up, it squeezes on our arteries, and these arteries send the blood out to the extremities. Now that we have it there, the muscles need some other things. We need energy, and so the liver, which was storing sugar before, is now going to dump the sugar into the bloodstream to increase our blood glucose. We're going to also stimulate increased breathing rate. What do muscles need? They also need oxygen. And then we're going to turn our heart rate up, which is going to help get it there faster. So now we have blood to the extremities where the muscles are, and there's oxygen and glucose in the system, and everything is ready to go for physical activity. Rest and digest, fight or flight, back and forth. Every normal person is allowed to do at least one of these per day, but it is the fact that you can go back and forth freely that allows you to heal. If we were unable to get out of one or the other, we would have a problem doing anything physically or active, or we would have a problem being able to regenerate and absorb nutrients and repair. And so now we're going to look at how this whole system falls apart. So at some point in time, you had a head trauma that could have been literally at birth. If you came out the wrong direction, sunny side up, maybe you were a forceps baby, maybe you were a vacuum baby, maybe mom and dad dropped you, maybe you fell learning how to walk, or you got into fights with siblings, or there was a sporting accident, or you fell and hit your head because of ice or a car accident. How many different ways can you have a different trauma to the head and neck? And these joints up here that take a big enough force will misalign. Now they're actually designed not to misalign. I'm going to show you real quick. If you can see, the angles of the joints of C1 under the skull are actually converging in their angles. Okay, can you see that? Why would we need converging angles? This is like a wedge. If you've ever built card houses, you don't stack the cards like this, you stack them like this. What for? The purpose is for stability. They support one another. And so the vectors of these joints are in a converging angle, and they allow them to be for support and stability. The rest of the joints in the spine, starting from C2 on top of C3 down, we're going to see that the joints run in parallel. And it doesn't matter where in the spine you are located, if it's the thoracic spine or the lumbar spine or the cervical spine, the joints are in parallel. Why? Because this is where we need more motion. So C1 under the skull, we have converging angles, but everywhere else we have parallel joints. And so the joints up here are for the stability purpose. But still, a big enough force and we will misalign these joints. And as soon as we do that, we're going to actually compress that space. And remember, it's this structure right here that sits in that space. Where the pink is shown right here, this is actually in between C2 and C3. So the base of the brainstem sits all the way through C2, and you can see that right here. And if we compress that structure, how many nerves are traveling through that hole? All of them. If we compress a nerve, can we adequately send sensory information into the brain? No. And so if we can't send information in, then the brain doesn't really know exactly what's going on. Therefore, the motor response is also altered. So that includes our ability to detect our environment, our ability to detect injury or disease or infectious processes, and therefore the brain can't have operational control or movement in response to these sensory information, or we can't heal or regenerate or maintain what is called homeostasis, which is the health and regeneration and the ease of every tissue in the body. And so we start to see dysfunction there, and that degree is directly related to the level of compression present based upon the certain type of misalignment. If we have a little bitty misalignment and a little bitty compression over the course of decades, we see a progressive loss of function. But if we have a big misalignment and a big compression, we can see a very acute dysfunction and disease process happen. Either way, depending on how much is compressed, you're going to see a 1-to-1 ratio of the level of miscommunication. And depending on what's misaligned and what's compressed, it manifests all these different ways in different people with disease. So if we run into one of these cranial nerves, we're going to start seeing loss of function to vital functions. And so we can have things like loss of sense of smell, vision and pupillary constriction issues, eye movement issues, and asymmetries between them. We can get trigeminal neuralgia, jaw pain, jaw dysfunction, clicking and popping, tension headaches, face pain, teeth and gum disease processes. We can have facial asymmetries in how the face moves or weakness on one side. We can have dry eyes, dry nose, dry mouth, and loss of taste. We can have imbalance through the vestibular system, which can lead to vertigo. We can also have tinnitus and deafness. Pressure is allowed to collect within the inner ear, and fluids can collect in there because they can't be drained through the eustachian tube. Chronic sinus pressure, sinus infections, ear infections, too high or too low gag reflex or swallowing sequence, too high or too low blood pressure, and then we can also lose parasympathetic input to every major organ below the neck through vagus nerve. And then we can have the accessory nerve, which now is struggling to hold your head on the horizon. The upper trapezius and sternocleidomastoid muscles contract constantly to hold your head still, resulting in you feeling tightness and restriction in these muscles right here. That doesn't ever seem to let go, despite the fact that you may seek treatment for that. And hypoglossal nerve means we can't control the tongue movement. You can bite it or have speech impediments or swallowing issues. And all of those, you don't have to have every single one. It just depends on what's compressed. So do we have a problem yet? I think so. But then further, remember, cerebrospinal fluid is surrounding the entire central nervous system encased by your meninges. And that fluid has to travel like a hose through the foramen magnum. And if we ever kink a hose, are we not going to alter the rate and direction of flow as well as the pressure of cerebrospinal fluid? Absolutely. And so if we trap fluid inside the skull, what are we going to see? We're going to see first an increase of intracranial pressure. It feels like something inside the head is expanding and that we don't know where it's coming from. If the pressure is great enough and it happens to be trapped into the front, the only escape routes really outside of the skull are in the orbits. And so, especially in the front. So if we have pressure build up behind the eye, what do they call that? It's increased intraocular pressure, otherwise known as glaucoma. Or we can have blood flow, papilledema, we can have vein and artery issues in the back of the eye, and we can see loss of vision. If we have that pressure trapped in the back by the cerebellum, then the cerebellum can literally be forced through the foramen magnum, and then we call that Chiari malformation. Chiari malformation, as it's known today, is they think that the cerebellar tonsils are hanging into the foramen magnum, and their approach is to remove part of the bone structures there to create a bigger space. But really what's happening is that they're being forced through the foramen magnum, and then when the cerebellar tonsils hang through, they compress directly on the brainstem and then block the posterior aspect of cerebrospinal fluid flow, resulting in all kinds of problems and manifestations that are debilitating for people with these conditions. Cerebrospinal fluid flow also travels all the way down the spinal cord, and so instead of trapping fluid inside, sometimes we can have fluid trapped outside. And if there is that, then we're going to have a vacuum now. There is a negative pressure within the cranium. And if you've ever sucked on a balloon and you pull the air out of it, what happens to the balloon volume? It gets smaller. And so we can create this vacuum-like space inside the cranium, which makes the spaces where the cerebrospinal fluid flows smaller, thus reducing the rate as well. Pascal's law states that if we put a force into fluid, we're also going to have that force distributed equally in all directions. That's kind of like throwing a rock into a pond and it has a ripple effect. That's Pascal's law. If we put a force mechanically into the aspect of cerebrospinal fluid on the front or the back, or even on the sides, we're going to reduce the rate and change the direction, potentially, of cerebrospinal fluid flow, which now means we're going to have problems transporting neurotransmitters. This results in brain fog and memory loss, behavioral and emotional issues. Dopamine and serotonin can lead to depression and anxiety, and then we can have a problem turning on or turning off the brain. Either way, we're going to have a communication issue within your own head, within your own thought processes. Pituitary, remember the pituitary gets its signals directly from the hypothalamus through the brainstem about blood hormone levels, and now it can't receive adequate information, so its output is dysregulated. And then further, if some of those neuroendocrine hormones are transported through cerebrospinal fluid, we now have loss of control over other organs and their productions of hormones. Therefore, there is a system-wide problem with hormone regulation. The pineal gland can have problems transporting melatonin, which means our sleep cycle is going to be affected. You're either going to have problems going to sleep or staying asleep. And of course, the glymphatic system that is used to remove metabolic waste, toxicity, heavy metals, halogens, and infectious processes can't do its job, leaving some of these structures trapped within the cranium, and they'll further cause damage. Metabolic waste such as beta amyloid proteins, okay, this is what we see in patients with Alzheimer's. It doesn't matter what has happened. Every neurodegenerative disease process manifests first by having a kinked off hose and inadequate cerebrospinal fluid, and depending on what metabolic waste, what toxicity, what infectious process, and depends on where it's trapped, manifests all the different neurodegenerative disease processes. And then further, we can have what is called CTE, or chronic traumatic encephalopathy. The NFL is dealing a lot with this. They take lots of hits to the head. They trap cerebrospinal fluid. There's physical damage to the actual brain tissue that the nootropics, the structural components necessary to rebuild the brain, can't be transported adequately to the brain to repair it, and therefore we see a loss of brain tissue, leading to all the issues that they see with CTE. So how big of a problem is cerebrospinal fluid inadequate flow? It's a very big problem. So how many of these hormones are we going to have a problem with? Water retention, too high, too low. Blood pressure, too high, too low. Blood volume, too high, too low. Dehydration can occur in these scenarios, and excessive swelling can occur. We can have dysregulation of your menstrual cycle and labor. We can have breast development, breast milk production, and breastfeeding issues. With the adrenal gland, we're going to see stress hormones too high or too low. So we're either going to be in a chronic state of fight or flight, or we're going to have chronic adrenal fatigue. We can't adequately make vitamin D, which results in bone density issues. We have issues regulating melanocyte production, resulting in UV radiation absorption problems. Our aldosterone levels can be dysregulated. Therefore, our electrolyte levels are dysregulated. This leads to neurological dysfunction, heart dysfunction, and muscle contraction dysfunction. All right, and our immune system can't adequately be controlled. So where it's out of control, or it's not able to start responding to infectious or disease processes. Growth hormone, we see inability for kids to adequately grow. They're stunted in their growth, or we have an inability for you to recover from workouts, injuries, disease processes, degeneration cannot be adequately recovered. So we're breaking down faster than we are rebuilding. And our sex hormones can be imbalanced, too high and too low. And these are not separate issues. This is one problem originating right here. And the last thing we need to see, we have where's the parasympathetic input located, and it's right up in here in the brainstem. And if we are compressing parasympathetic fibers, can we adequately get into parasympathetics? No. And so since we can't get into parasympathetic, we can't rebuild adequately or get into homeostasis or absorb nutrients or go to the bathroom properly. And so we're stuck where? Over here. You're not rebuilding, so you're constantly breaking down. And if we're constantly breaking down, we're going to call that disease. And disease may manifest with a couple of symptoms. Some of these you may understand and have yourself. And the last thing we need to understand is that the parasympathetics are located right here in the brainstem. And if you're compressing parasympathetic activity, what are you doing? If you can't get into parasympathetic, you must be over here in sympathetic. Parasympathetic allows us to heal, if you remember, and regenerate and take in nutrients and go to the bathroom. And so if we're no longer rehabilitating or regenerating ourselves, we are in a chronic state of breaking down. And if we're breaking down all the time, they call that disease. And signs and symptoms of disease include dilated pupils, dry mouth, dry eyes, elevated heart rate, breathing rate, and blood pressure. Can't adequately digest food, gallbladder and pancreas don't work, your blood sugar's too high. We can't pass food through the intestinal tract or absorb nutrients adequately. We have problems with chronic constipation, diarrhea, or alternation, resulting in IBS. And we have problems going to the bathroom in general, as well as sexual dysfunction. And are those separate problems? No, that's all one problem. You're just stuck over here in a chronic state of fight or flight. And of course, if you're in chronic fight or flight, what does that do to your mental state? And so we are in this this constant state of anxiety or stress, and that leads to having all kinds of issues mentally with people as well. So what just happened? Well, we have a compression here on the brainstem through upper cervical mechanical compression and misalignment. And so what is the body going to do about that? Do you think it's just that easy for the body to fall apart? And the answer to that is no. And so what we're going to see now is the body's compensation. Let me give you an example. If you ever went out into cold temperature and you couldn't maintain your body heat, the first thing your body's going to do is tell your muscles to contract. Okay, so you're going to start to shiver. The purpose of burning glucose has a byproduct of heat, and so we're going to attempt to keep heat going by contracting muscle tissue. That's a sympathetic response because the blood is where? The blood is out by the extremities, giving the muscles the activation it needs. And if we can't maintain our heat then, we're going to shunt the blood away from the extremities and we're going to put it towards the midline, the central nervous system, and the vital organs. Why? Because those are more important than what? Our fingertips and toes. And so where do we see frostbite first? Fingertips and toes. The body understands that there is a hierarchy of importance, whether it means survival or not. We're going to talk about things that are more essential to your survival. Your vital organs you need, your heart you need. Okay, you don't need your fingertips and toes. So we would like to keep those maybe, but if it comes down to whether or not you survive, we're going to actually preserve things that are more important. So we'll be willing to sacrifice and lose our fingertips and toes if it means we get an extra hour or two or however long for your survival processes. And so what do we do now when we have this space compressed? Remember what sits in there, we have our vital function control, all right? And the brainstem, the main source of all of the nerves and the communication and the control over the body. Name something more important than that space. And there's not anything. Not even your brain is more important, because if you had no brain activity, you simply are unconscious, okay? But if you still have brain stem activity, you can beat your heart and breathe and have all of your vital functions, but as soon as you sever the brain stem, what do you get? You're dead. And so there is nothing actually more important than that space. If you remember, we talked about earlier that these joints up here are designed for stability purposes, okay? They're in wedged angles to allow for stability. But further, these joints on top of C1 and underneath the skull are also U-joints, okay? U-joints meaning that it's a bowl and a knob, right? And so there's some sort of anatomical locking position there. And the fact that they're converging and wedged means there's lots of stability, which is great for protecting that space, but when it comes to correcting that problem, it's actually going to work against us. And so your brain and your body can't simply just fall back into alignment, not up here at least. And so we're now having a problem because this space is occluded, these upper cervical joints are misaligned, and they're stuck there. And so what are we going to do? The brain only has one option. Let's just pretend, okay, that the upper cervical spine and the spine below, there is a misalignment of the upper cervical spine. And what's the problem? That space, okay, is occluded in some degree. I'm not thinking that you're going to actually be that far apart, but you get the idea. There's a misalignment, and we can't fix this. So what can the brain do? Remember that we had parallel joints in the rest of the spine for more mobility. And so the brain is going to tell the vertebra below to move to match it. It's not going to move this way, this way, this way, or anywhere other. We're going to move exactly where it needs to be in order to open up the space. And so you think your brain doesn't know what position the upper cervical misalignment is in? It absolutely does. It knows everything. And therefore, we're going to create what is called a compensatory scoliosis. It's an abnormal motion of the spine. Front, back, left, right, rotation, it doesn't matter. It's whatever the position is needed based upon the exact position of what's happening up here. So what these vertebrae are doing are going to be what the vertebrae below do in response, and that allows the space where the brainstem, spinal cord, and cerebrospinal fluid flow to be open. All right, and that happens as something that goes down the entire spine. How does it get there? It gets there by the brain contracting the paraspinal muscles. Okay, muscles don't contract by themselves. They require a signal from a nerve, and the nerves travel to the central nervous system. All right, and we have paraspinal muscles traveling on both sides from the base of the skull, attaching to every vertebra and all the ribs and all the way down to the pelvis. Some of these muscles are pretty big, some of them are pretty small, and they control all the motions that your spine can do. And think of it like, say, a tower. Maybe it's a cell tower or a cable tower or a radio tower. It's very tall, and we don't want it to fall over, so we're going to have it stacked upright by keeping guide wires pulling it in all directions equally. Okay, but if I snip a couple of these wires, the tower is going to lean wherever there is more tension. It's the same concept here. Okay, so if we have a need for the spine to be moved in one direction, we're going to contract the muscles on that side more, and we're going to turn the other muscles on the opposite side down so that we can move the spine where it needs to go. Then those muscles don't let go of that tension because we need to keep that spine in that spot. And so you start to create this compensatory scoliosis, and you have various contractures and spasms within the back. Okay, and once that happens, it's great because now your space is more open, but what didn't adapt is the force of gravity. And that is the 90-degree force to the floor that you experience all the time. And your spine, which used to be straight, it was designed to handle that force, is now no longer handling that force symmetrically. We have joints on the right and left side that are experiencing that force differently. There's a disc in between every single vertebra that has a fluid encased inside. The fluid is called your nucleus pulposus, and the fibers that surround it make up your disc. And now we're starting to see that fluid be pushed out the path of least resistance. All right, and since fluids cannot be compressed, they will erode the annular fibers, causing what we call a disc bulge. And if that bulge goes backwards, it will touch the structure that's right behind it. And what is that? That's your spinal nerve. Okay, and so if we compress a nerve, what do we get? Numbness, tingling, loss of function, and miscommunication, inability to operate, control, and maintain homeostasis of everything that that nerve goes to. To some degree, it's less. All right, but that was the sacrifice your body was willing to make, because one nerve being compressed is a heck of a lot different than all of the nerves potentially being compressed, as well as the vital functions. So the inherent sacrifice is the spine and different parts of the body depending on how it manifests. All right, and if that fluid manages to escape the outer border, they're going to call that a disc herniation, which is exceedingly painful, but it's just a progressive state of the same problem. All right, you're breaking down, oops, big injury, you were tipped over the edge. All right, so as we go through this process of degeneration, right, what does generate mean? To make. What does regenerate mean? To remake. And so degenerate means to break down. As we are breaking down, the body's back channel is to start to fuse vertebra together where there's perceived instability. We will actually calcify ligaments in order to create bone spurs that will fuse two vertebral levels or multiple joints that are in proximity to one another together to create stability where there was perceived instability. It can't just undo the scoliosis until we have corrected the main problem for the reason why it was there in the first place. And so osteophytes, they're not actually the problem, they're the body's response to the problem. Okay, so now you have a bunch of symptoms. These are not the disease, these are the responses to the disease, these are the dysfunctions, these are the effects. And you're going to different doctors because you have an issue with either pain or dysfunction, or something is manifesting in some sort of way and it's not correcting itself. And so maybe you go to get a steroid shot or an anti-inflammatory, which really just shuts off the healing process, but it also shuts off your awareness of this healing process and the pain and symptoms associated. But as soon as the anti-inflammatory wears off, you're going to go back to where you were. And then in most cases, if they're long-term anti-inflammatories, we're going to see a further degeneration because the healing was not allowed to occur while that was taking place. And therefore, we're in a worse shape. Maybe the next step is to do surgery or have a fusion done or a discectomy or put in a new disc. And if we take pressure off of a nerve, we're going to get symptomatic relief, but we didn't fix the problem that was the reason why it was there. And so we began to see after surgery, above and below the surgical procedure, there's a continuous degeneration. And so things above and below take the extra heat. Maybe you're going to do rehab. Maybe you've been told you have contracted muscles that need to get work done. Maybe you have poor posture. And so we're going to do certain exercises and movements, remembering that muscles don't contract themselves arbitrarily. All right. And so if we have weakness on one side versus the other, simply doing more reps on that one side is not going to get you the strength, because you have to have the nerve and the central nervous system dictate muscle contraction and the ability to heal. And so that doesn't work. And so maybe you end up at a chiropractor's office, and a chiropractor, maybe someone's told you, I had some great results with chiropractic. They're going to hopefully take an x-ray. This is your central nervous system we're talking about here. And they're going to say, oh, Mr. and Mrs. whoever, you have degenerative disc disease, degenerative joint disease, you have scoliosis and subluxation. There's misalignment here. I need to see you 2 or 3 times a week for the next, pick a time frame. And they're going to adjust you. And if they adjust you in the right direction, you may get some depressurization off of the joint, which results in symptomatic relief. And all of a sudden, though, within a day, a week, maybe it's just an hour, maybe it's a month, I don't know, it's going to go right back. Because who wanted the scoliosis here? The brain did. It was there because it was compensating for the upper cervical misalignment. And so, try as you may, you can adjust this 100 times. It's not going back. It's going to stay, and it's going to go back to and revert back to the position that it was required to be in. The brain wanted it there. And so, do you think that it would maybe be prudent for us to figure out what's going on up here? Absolutely. And why can't traditional chiropractors just fix this? They do not teach you how to correct the upper cervical spine in chiropractic school. They do teach some techniques that allow you to diagnose subluxation and misalignment and correct those. And they teach you a lot of how to do joint biomechanics and to manipulate the joints. Okay, so let's just say if I want to get a joint to crack, right, to cavitate, I have to take the joint along the vector in which the joint moves, and then I have to push it just past. And then if I do that, we're going to hear the sound, the crack, right? Which is really just the pressure being relieved from within the joint. And so there is a vector that is still required in order to correct a joint. And if I'm taking the joint along the wrong vector, or if I'm just doing this to make a sound, then we didn't actually fix anything. And if you apply that to the upper cervical joints, remember, we have U joints, knobs and bowls, in a wedged angle in C1 under the skull. And so if I was a traditional chiropractor adjusting this joint, I would need to move the joint along this plane in this vector. But let's not forget that C1 is one bone, and so that force applied here is the same force applied to this joint. Well, this joint moves this way, and so if that force applied to this joint, we will get that occurring. And so we have a misalignment of this joint right here, which now I have to come to this side and correct this joint. I'm either going to move it this way or this way along the vector of this joint, and that force applied over here will produce misalignment here. And so now we just kind of go in a circle, and we're constantly having a misaligned upper cervical spine. If you're misaligned here, what do you get? You get compensatory scoliosis. And so you simply cannot crack the upper cervical spine and correct it. It must be done in such a way that you don't crack it. And so 2% of the chiropractic profession, they're called upper cervical specific chiropractors. They have known since around the 1930s that you can't crack this. And they have known that this is the most important area of the spine. And if you can manage to address this issue, you can help more people than any other healthcare profession, doesn't matter what they are, that exists today. And so they differ and they argue amongst themselves about, well, which do we do? Do we do C1? Do we do C2? Is it both of them? Is it by instrument? Is it by hand? What's the position of the patient? What are the objectives? What are we trying to accomplish? And how do we know that we've done our job? And so where they all agree is that this is the most important area of the spine, that you can't crack it, but they also agree that in order to figure out what's misaligned, they're going to take an image. And so when you take an image, we have to think about what is the function of the joint though. A function of any joint, whether it's up here or down below, while there may be more stability required here and designed to be here, these are still joints, and joints' purpose is to provide stability and mobility. And so joint's functional component is to move. And if I want to diagnose a movement problem, how do I do that on an image? An image is what? It's still. And so if the image is still, that would be like if I had a door that was shut and it wasn't locked and I couldn't figure out why it wouldn't open, I wouldn't take a picture of that to figure that out. I would have to actually perform movement tests, and I would need to see the movement in order to determine how something up here doesn't move correctly. Any misalignment is a movement disorder. And so even though some of these misalignments may be really big and they're very easy to identify on image, some of them are not. Some of them are actually very small. And it's something that the whole upper cervical complex is doing. C2 on top of C3 has 12 potential misalignments. C2 to C1, there are actually no misalignments that occur here. C1 wraps around the dens, okay? And it's where the majority of the rotation of your neck and your head occurs. And so they are attached via ligaments, the apical and transverse ligaments that keep these snug and firm, and the articulating portions of these vertebrae, C1 on top of C2, is allowed to freely move. There's no bony locking position. Therefore, there is no misalignment that can occur outside of torn ligaments that attach these, or a broken neck, okay? So there's no misalignment that occurs between C1 and C2. And then C1 under the skull, there are 10 potential misalignments that you can have. And so the combinations between C2 on top of C3 and C1 under the skull is over 100 different variables. And how are you supposed to figure that out on an image where you don't get all of the information? So they're missing information, incomplete, and they're doing their best with what they have, but if you don't have all the information, then you're going to be unable to fully diagnose. If you can't fully diagnose, then how do you correct it and stabilize it? And some of them are having trouble with this, and they call it cervical instability or upper cervical instability. The fact is, you have an anatomical joint that allows you to be stable, and if we had the complete information, then we would be able to fully stabilize this. So we can't do an image, at least not for the purpose of diagnosing misalignment. Images are great for pathology, determining what's the current state of the spine, the level of degeneration, and anything that might prohibit your ability to do this. But we need to do specific movement tests that allow us to dictate and determine what's going on in the upper cervical spine. So if you remember, when we have upper cervical spine misalignment, we're going to get a compensatory scoliosis. If it's over here, the spine moves below to match it. If it's over here, same thing. And the brain is the one that dictates this. Remember, we're going through the paraspinal muscles all the way to the pelvis. And from the base of the skull to every vertebra and every rib, there is going to be asymmetrical tension. When we have asymmetrical tension, we create the scoliosis, which means on the pelvis bones themselves, they're going to be one side that has more tension than the other. And when that happens, that pelvis gets elevated just a little bit, bringing with it what also attaches the leg, all right? And so when the leg is pulled up higher, what do we see? A potential short leg, okay? And I'm sure at some point, some of you guys have been to various doctors, chiropractors mostly, where they tell you, oh, you have a short leg. And some of the response from these doctors is, well, let's put a heel lift underneath. Well, that doesn't work, and it usually causes more aggravation. And then some of the chiropractors are literally pulling on your leg to try to lengthen that. Pun intended, they're pulling your leg. Some chiropractors are adjusting the pelvis themselves, where they've been taught that the short leg discrepancy is derived from pelvic misalignment. But the second that you get off the table, you're going to go back to having that same pelvic misalignment and short leg, because the short leg was not derived from the pelvis, it was through the pelvis. So instead of using imaging to determine misalignment, we're going to use motion tests, where the functional unit of the upper cervical spine, C1 and C2 together, if they are moved by the patient, or as the chiropractor, we are stressing the individual joints along the directions in which they move, we can see a further compromisation or a further opening of this space. And if we further compromise it, the leg lengths actually get worse. If we further open it, then the leg lengths become better. And so when the joints are misaligned, we can see this movement and change happening, and we can use it as a measuring tool, a binary algorithm to dictate what's happening at every joint. Not only can we tell what joints are misaligned, but we can tell the direction in which they need to be corrected, the order in which they need to be corrected, and the angles in which they need to be corrected. So if you have the full picture, if you have the combination to the lock, simply unlocking it becomes a piece of cake at this point. Once you have unlocked it, there is objective proof further that you were successful, because if you're in alignment, where should the feet be? Right in the middle, right? And then all these tests will produce no change because the joints are where they should be, which means you're not further compromising or opening the space, indicating there should be no movement that you would see. So everything about this is a purely objective stance on how we identify the problems at every joint and the fact that we were able to correct it. There is one additional caveat that we need to take into consideration, and that is what is called layered misalignments. When we have layered misalignments, what happens is if we have the first original misalignment, right, the brain tells the spine below to compensate. And then what happens if we have another trauma in a different direction, maybe this way? Where does the spine below going to go? It has to go over here. But you didn't actually remove the original misalignment nor the scoliosis that was compensating from the original one. And so you did this in addition to. This is now something the whole spine is doing. So maybe you could even have another trauma in a different direction and another compensatory scoliosis and another one and another one. And so when you show up to get the first one corrected, what you see is the last one that you acquired, right? And the last misalignment, you're going to bring into alignment, and then instead of having your spine be able to match that new position, it's actually going to go back to the previous compensation, and it's going to draw you back out of alignment with a new misalignment. And how would you be able to diagnose this new misalignment unless you were taking a new image, which still is incomplete information? But if you don't clear that new misalignment, then you're never going to get through the rest of these layers. But the joints up here are actually not designed to be misaligned. They're designed to stay in alignment. And so as you go back through, and you will, every single misalignment you've ever had, once you get to that last layer of misalignment and you clear it, then the joints will stay in alignment unless you have a further trauma, an additional trauma that would create another layer. And so if that space stays open, then we're going to be able to communicate, and we're no longer compressing what? The structure that sits within. So if we're no longer compressing nerves through the brainstem, are we going to be able to heal vital functions and return function to those? Are we going to be able to heal and communicate with all the nerves that are going to the various parts of the body? Cerebrospinal fluid flow is allowed to return. And so how many things can your body actually go back and regenerate and heal if you have adequate communication and it stays open? So now that we have this space open, we've cleared all the layers, the space is going to maintain its patency, and we're not coming out of alignment again unless we have another major trauma. Once the space is open, we're going to be fully communicating, which means the brain's going to say, wow, look at all this stuff that was not operating the way that it should. Look at all these tissues that were degenerative or not healed. And so it's going to immediately start to reestablish the healing process. So usually the first time that we clear a layer, maybe it's your only one, maybe there are others, this process begins, and we're going to call this cycle retracing. You took a certain journey to get to wherever you were today, or wherever you are in life, and as soon as you clear a layer, your body gets turned around, and you're going to go back through every single path and step you've ever took, through every disease and injury and degenerative state that you have been through, all the way back to the beginning, but you're going to do this at lightning speed, and we call this retracing. Thank you for watching this video. This concludes part 1. To find out more about retracing and the healing process, as well as the essential nutrients required to rebuild, please watch part 2.